Hello guys, today we'll learn about pharmacotherapy, focusing on methadone and suboxone. Methadone is a syrup and suboxone is a film they put into your mouth. So as you can see, in this world, we have a lot of problem with opioid addicts, especially people on the street. They are addicted to opioid and then they are not able to manage their life. They often get fired from their job, become far from their family or friends, and it is a real problem. So we are using this pharmacotherapy to fix this problem. In 2021, excluding Queensland, there were 47,500 people who are being treated with this pharmacotherapy for opioid dependence in Australia. So what made them drug addicts? Among the individuals who disclosed the main substance contributing to their addiction to opioids, 44% of people said heroin made them drug addict. 4.7% said oxycodone made them drug addict. 4.3% mentioned buprenorphine, and 3.3% reported methadone. So why is this opioid addict a social problem? Because it cost a hell lot of money. It costed $15.8 billion annually. This is statistics from 2015, so it is larger now. So illicit drug users are more likely to get fired from normal job. They are more prone to undergo mental or physical health problems. Illicit drug users often end up as opioid use disorder, which is a chronic condition that requires ongoing therapy. Without treatment, opioid use disorder may lead to disability or premature death, or end up as a homeless on the street. Why is it hard for them to stop opioid right away? It is because of the withdrawal symptoms. When the opioid addicts stop opioid, then they will feel dysphoric mood, nausea or vomiting, muscle aches, lacrimination, rhinorrhea, sweating, or diarrhea. They will start to yawn, have fever, and not able to sleep at night. They will have some pupillary dilation, and it is quite scary to watch them doing it. So, we are using pharmacotherapy to help these people get away from opioid. Methadone and suboxone are indicated to treat opioid use disorder. The utilization of pharmacotherapy in the treatment of opioid dependence allows people to achieve stability and gains control over their opioid consumption. Pharmacotherapy makes it possible for them to not crave too much. This will improve their social situation, such as keep getting a job or improving relationship with other family members or friends. After a comprehensive evaluation, the healthcare provider, in collaboration with other health professionals, provide the 3 maintenance options for opioid replacement therapy in Australia. And these 3 maintenance therapy are methadone, buprenorphine, and suboxone. Suboxone is the combination of buprenorphine and naloxone. So let's check out why these methadone or suboxone are used as pharmacotherapy. What kind of advantages they have over the opioid. Firstly, let me tell you about methadone. Methadone is a strong synthetic opioid agonist. Due to its favorable oral bioavailability and extended half-life, methadone is administered in the form of a daily oral dose. So usually it comes as a syrup. And this syrup is 5 mg per milliliter. So because methadone has good oral bioavailability and long half-life, it can be taken daily. Note that methadone is also used to treat as a treatment of pain. So according to 2015 revised policy, methadone tablets, not just syrup, methadone tablets can be an option to enable a stable person to travel overseas under very limited conditions. So if the person is on the pharmacotherapy and has been using methadone for a long period of time, and when that person wants to travel abroad, then they can take tablet instead. So how do we commence methadone on a specific person? You have to check several things. New people should be dosed with caution because deaths in the first 2 weeks of therapy have been associated with inappropriate doses where tolerance was not achieved or when other CNS depressants were taken together, which means that you have to check the drug-drug interaction before starting someone on methadone. Yep. So usually the lowest observed toxic dose for the commencing patient is less than 20 mg for a 70 kg person, and the maximum starting dose is 30 mg, which means because methadone syrup is 5 mg per milliliter, the lowest toxic dose for the person is 4 milliliter or less, or the maximum starting dose is 6 milliliter or less. The maintenance dose differs from person to person, and it is usually 25 to 100 milligram per day. Methadone has a somewhat slow onset of action. The peak effect is achieved within 2 to 4 hours after dosing, and it has a long half-life. Toxic effects may become life-threatening many hours after ingestion, so be aware. And also, these you should check the drug interaction, especially on these medicines such as benzodiazepine or other CNS depressants or other opioid agonists or other sedative antihistamines such as chlorpheniramine. You have to check if the patient is taking this or not because drug interaction is serious. So methadone users should not take this kind of benzodiazepine together. It should never happen. Suboxone film. Yeah, let's talk about suboxone film. So suboxone film is kind of less strong than methadone because methadone is a full opioid agonist, but suboxone film is partial opioid agonist. So overdose risk in suboxone is less. It's less likely because the ceiling dose response and its weak agonist activity. So suboxone film comes with an 8 mg and 2 mg film. 2 mg one is a green box and 8 mg one is a blue box. So you have to keep in mind that suboxone film should not be cut or divided. For example, if the patient say, I want to have a 1 mg dose, I'm gonna cut this into half. You should say, no, you should not cut that into half. Yeah. And usually the prescriptions for doses should be achieved with the available dose units. And that is a combination of 2 mg and 8 mg films. So when the doctor writes the prescription, they write something like a 12 mg a day or like a 4 mg a day. Because, for example, 12 mg can be divided into combination of 8 mg and 2 mg. 8 plus 2 times 2 equals 12. And 4 mg is 2 times 2 mg film. So usually doctor doesn't write something like 5 mg. It is so random. It cannot be achieved with a 2 and a 8 combination. So yep, this suboxone film. Thank you for listening. Today we learned everything about methadone and suboxone for pharmacotherapy. Make Australia opioid-free again. Make Australia a safe place to live. Bye.